I'm here to pick up my blood pressure medication.
Can I ask your name?
John Smith.
Oh, yeah, okay, Mr. Smith, I think I have it ready. Oh, yes, it looks like it's right here. It looks like you haven't filled this since April. Do you know that not taking this medication can cause a heart attack or a stroke? Do you want to talk about that?
Well, it costs too much and I feel fine.
Blood pressure is called the silent killer. You may have symptoms of high blood pressure and feel completely fine. Do you want a stroke?
Of course I don't want a stroke. Can I just get my medication?
Of course you can, but I don't think you understand the importance of this medication considering your non-compliance. It's been since April.
You know what? I'll just get it somewhere else.
You will?
I'm here to pick up my blood pressure medication.
Oh, hello. Can I ask your name?
John Smith.
John Smith. Nice to see you, Mr. Smith. Go ahead and take a seat. Okay, it looks like I have it right here, Mr. Smith. Oh, it looks like you haven't filled this since April. Do you want to talk about that for a minute?
Well, it costs too much, so I just take it every couple days and I feel fine.
Okay, so it sounds like you're concerned about the cost of this prescription. Is that correct?
Yeah, I'm frustrated. It costs $300 a month and I only have $800.
Okay, that is frustrating. Would you mind if I called your prescriber and, maybe we could find a medication that's more affordable for you?
Well, I'm sure she prescribed this for a reason.
Okay, yeah, well, a lot of times there are a lot of medications that are a lot like this one that work in about the same way. And based on your insurance, sometimes the cost of the drugs can be a little different. What do you know about the benefits of this medication?
Well, not much really, just that it's for my high blood pressure.
Okay, may I share some information with you about high blood pressure?
Okay, but I only have 5 minutes.
Okay, well, high blood pressure can have some serious conditions, such as heart attack or stroke. And taking this medication can reduce those risks, but you have to take it every day. High blood pressure isn't like some other diseases where you feel sick. Usually if it's high, you feel just fine.
Really? My dad had a heart attack and my mom had a stroke and I don't want that to happen.
And I don't want that to happen either. How about I call your doctor and I get back to you on what we come up with, either today or tomorrow. Does that sound reasonable?
Sure. Hey, thanks for looking out for me.
You're welcome.
I'm here to see the pharmacist for my diabetes.
Hi, I'm Trevor the pharmacist. May I get your name?
I'm John Smith.
Hi, Mr. Smith. Your prescriber sent you to see me because simply your diabetes is out of control. I want to go over some information to help you get back on track.
Well, I don't think it's that bad. I just need to get my driver's license and the doctor says I have to see you before he'll sign the form for me.
Well, I can help you control your diabetes, but you're going to have to listen to the information I give you. For starters, your Mountain Dew.
I'm not giving up on Mountain Dew.
Mountain Dew is really bad for diabetics. How much sugar do you have in a day?
I don't know. I drink 3 or 4 liters of Mountain Dew a day, and Other than that, my diet's pretty good.
We can work on your diet later. How about your medication? Do you even take it?
I quit taking metformin because it tears me up, and I drive a truck, so after my first accident, I quit taking it.
You need to take your medications. Do you want to have kidney failure or possibly an amputation?
You're telling me I'm going to lose a leg?
If you don't take your medicine, you will.
Well, I need something else because I ain't taking metformin.
Metformin's the first line for diabetes treatment. We could start with, maybe a lower dose, but do you even want to control your diabetes?
I don't want to be miserable just to control it.
Well, if you're willing to make sacrifices, I really can't help you.
Well, then I guess we're done here. I'm here to see the pharmacist about my diabetes.
Oh, hi, my name's Trevor. I'm the pharmacist here. Can I get your name?
I'm John Smith.
John Smith. Nice to meet you. Go ahead and take a seat, John. Do you mind if I call you John?
That's fine.
Okay, thank you. So, tell me why you're here today.
I'm just here because I need my driver's license form signed, and my doctor won't sign it until I see you. But I'm going to tell you right now, I'm not going to quit drinking Mountain Dew. I drink about 3 liters a day.
Okay, so it sounds like your driver's license is really important to you.
Yeah, I drive for a living.
Okay, wow, I guess that really is important. Tell me, why wouldn't your doctor sign the form?
I have diabetes and my A1C is too high.
Okay, so what do you know about A1C?
Just that 14 is too high.
All right, well, do you mind if I share some information with you about that?
Well, I'm here, aren't I?
All right, well, A1C measures your average blood sugar over the past 3 months. And 7% is our goal, and you're at a 14, and that's too high and can increase your risk of complications.
Well, my dad lost a leg and I can't have that happen.
Wow, okay, so controlling your diabetes is a priority for you.
Of course it is.
Well, on a scale from 1 to 10, 1 being not a priority and 10 being super important, where would you rank this?
I'd say a 7.
Wow, that sounds like a pretty high priority. Can I share some information with you on how to control your diabetes?
Okay.
Well, we use 3 different ways to control your diabetes. We have physical activity, medications, and food choices. And those are all really important factors for controlling it. And since you discussed this and brought it up, do you want to talk a little bit about Mountain Dew?
I told you I'm not giving up on Mountain Dew. It's the only thing that keeps me awake when I drive.
Okay, so it sounds like controlling your diabetes on one hand is a big priority for you, but Mountain Dew is also a priority for you.
That's right.
Well, what role do you think that Mountain Dew is playing on your blood sugar levels?
I never really thought about it.
Well, 3 liters of Mountain Dew, like you said, that you drink per day, actually contains about 2 cups of sugar, and that can throw off your diabetes control. Do you want to talk about some ways that maybe you could cut back on your Mountain Dew?
I don't know. I'm not sure if I can.
Well, it sounds like it will be tough. Can I share with you a few ideas of possibly how we could go about this?
Sure.
Okay, great. So there's a few methods we could take. My personal favorite is you fill up half the soda with diet and then maybe half of it regular Mountain Dew, or possibly you could skip like having a Mountain Dew with a meal, just drink water instead. Or if that wouldn't be enough, you could try something that has like a fake sugar substitute in it, like Crystal Light. It's refreshing. And then any of those options would probably help you control your diabetes better. Now, do any of the things that I just laid out for you sound like something you could reasonably do?
I think maybe I could try 3/4 regular and a quarter diet.
Hey, that's a great start. And change is hard, but I'm here to support you.